In this interview, Mr. James Logan, a 31-year-old single African-American male, is coming to his primary care provider for his annual wellness visit. Good morning, James. How are you?
Good, thank you.
Good. Well, today I wanted to talk with you about the screening tool that you completed in the waiting room. This is part of our effort to have more comprehensive care. Would that be okay if we talk more about that?
Sure, that's fine.
Okay, great. So the screening tool that we use looks at marijuana and alcohol use. Is it okay if I talk with you about your alcohol and marijuana use?
Sure, okay.
So it says here that you drink 2 or 3 times a year. Do you drink beer, wine, spirits?
If I drink, it's red wine.
Okay. And it says that when you do drink, you have 2 or 3 drinks. Is that about right?
Yeah, very seldom. I don't like alcohol, 1, because it makes you fat, and 2, my dad kind of got excessive with alcohol and was hard to deal with. I don't want to be like that.
Well, yeah, it sounds like you have some really good reasons not to be drinking too much. Is it okay if I share with you kind of recommendations around the low-risk drinking recommendations?
Sure.
Okay.
Well, I'm not an alcoholic.
Oh, no, I didn't mean to give you that impression at all. I'm sorry. We just like to talk to all of our patients about alcohol use in general. So is it okay if I talk with you about recommendations?
Sure, go right ahead.
Great. So in the survey that you did, it comes back that you are a low-risk drinker. And that means that you're having less than 14 drinks per week and less than 4 drinks at a time. And that means that you're at a low risk for the kind of health effects that come from alcohol use. Does that make sense?
Yeah, you're saying I'm not an excessive drinker.
Exactly, exactly, yep. And so that is helpful in preventing some of the consequences that come from too much alcohol use. So the first thing I want to talk with you is about your use of marijuana. Would that be all right? Okay, good. It sounds like you smoke at least 4 times a week. How many times during the day will you smoke?
Usually about 2. I'll have a joint in the morning. Nice little buzz gets me through the day and makes it easier.
Okay. And do you smoke anything else with it, like heroin or amphetamines?
Certainly not, no.
Okay.
No.
And are you're just smoking joints? Are you using a bong or a pipe?
Just joint.
Okay. So it sounds like the smoking helps you kind of get through the day at work and a job that you don't like much. Is that right?
Pretty much, yes.
And that sounds like it's pretty stressful. Do you usually smoke then later in the day?
Yeah, when I come home, I usually do half of the joint in the morning and the rest of it in the evening to get through the night, yeah.
Have you ever tried to cut down on your marijuana use or control it?
Yeah, yes, I have. And one of the big parts is my girlfriend doesn't like it sometimes. She says I'm disconnected. So yeah, I've thought about it.
Okay. Well, that's helpful information. Do you ever worry about the amount of money you're spending on marijuana?
Heck yeah. An ounce of good weed can cost from $250 to $300. So yeah, it's expensive.
That is expensive. Have you ever driven a car while you're under the influence of marijuana?
No, certainly not.
Okay,
no.
good. I really appreciate, James, you being open and honest and talking about your marijuana use with me. Would it be okay if I give you a little feedback on that?
Sure, go ahead.
Good. Okay. Well, marijuana is legal here, and it sounds like you don't mix it with any other substances, which is also very good. I do have some concerns about the impact of the smoking on your lungs and your physical health. What do you think about that?
Well, yeah, probably should go to edibles.
Yeah, that might be better for your lungs. The other concern that I have would be that it seems like you're struggling a little bit with your job and both your relationship, and you're using the marijuana to help you kind of manage those things. Did I understand that right?
Yeah, that's true. That's true.
Okay. I know I've given you a lot of information today. Can I give you a bit more feedback? Would that be all right?
Go right ahead.
Okay. So the other concern that I have with your marijuana use is on your relationship, and that social stressor is kind of manifesting. What are your thoughts about that issue?
I would calm the waters there if I backed off on it and on my job as well.
Yeah, you mentioned that you work with power tools, and being under the influence while using power tools is also a safety concern, really. What do you think about that?
It's probably not smart, and driving wouldn't be smart, and yeah, there's a couple of things to think about there.
Good, good. I agree. You know, your mood symptoms, we kind of talked about that earlier, but they may be related to your marijuana use. And I kind of want to give you some recommendations around that, kind of the two being connected. But first, I wanted to talk with you about if you would consider cutting down on your marijuana use at all.
I can see reasons to do it, so yeah.
Okay, great,
Yeah.
great. How ready are you to make a change in the use of your marijuana? On a scale of 1 to 10, 1 being not ready to change at all, and 10 being sign me up right now. Where would you say you are?
About a 6 or a 7.
Okay, great, great. So a 60 or 70% ready to change, that's great. Why isn't it a 2 or a 3?
Well, thinking about it, it would probably smooth out the relationship. Driving's not good. I can't afford a ticket. Working with power tools, not smart. Yeah, I'm
Yeah?
seeing reasons. Not there, but I'm seeing it.
Good, good. And it sounds like you want to live your life and really enjoy yourself.
Yeah, definitely.
Well, you know, we talked about the mood a couple of times, and I really do think that the mood and the marijuana use could be connected. Wow. We have somebody here in the office that you could talk with about both of those things. Would you be willing to talk with them today?
Sure. Yeah.
Okay.
Yeah. I see the connection, so yeah, sure. Might as well go for it.
Great. We'll get this finished up, and I'll get you in to see somebody. Hi, James. Thanks for completing the assessment in the lobby and talking with me today. It looks like from your assessment here that you're smoking quite a bit of marijuana, and I have a concern about that. It also looks like you might be clinically depressed because you scored a 7 on the PHQ. One option to consider is to take medications and stop smoking marijuana. There are no magic pills that can fix everything, but we do have some good medicines that have been approved for mood disorders.
Well, I'm not crazy about the idea of medication. In the commercials, the side effects list is longer than the benefits.
Yeah, there are some side effects, weight gain and a small percentage, some adverse effects. The potential for harm, though, is pretty low for these kind of medications.
Not interested, sorry.
Okay, well, if you're not interested, then we can maybe talk about it at your next appointment. Let's finish your history and physical and get you out of here. Well, in this interview, I really wanted to focus on making the patient feel comfortable, asking their permission before we talked about more sensitive subjects like their substance use, and then really negotiate with them about their change process to see where they are and how willing they are to make changes in their life, as well as their motivators. In this interview, I used some motivational interviewing techniques. One of those was asking about his level of readiness and his reasons or motivators to want to change, how his marijuana use has impacted his life, and then what he wants to do to change those things. You know, I think as a healthcare provider working in Colorado where marijuana is legal, I think it's important for us to kind of focus on the health and behavioral health consequences that come from marijuana use, rather than getting tied up in the legal landscape of newly accessible substances. You know, I think that marijuana being legal in Colorado is definitely a challenge, working in the mental health system. The legalization has often given people sort of this green light to use in excess, and really it's a psychoactive substance that has detrimental effects to the brain and can have mood symptoms associated with it. And so broaching the subject of marijuana use, even though it's legal, I think is really equivalent to the alcohol use, that even though that is legal, it can still be harmful when used in excess. Well, some of the strategies I used when I was interviewing this patient were to broach the subject from a very objective standpoint with his health as the primary concern, and equating that to the smoking and their impact on their lungs, and then moving into sort of some of the more behavioral and social consequences from his marijuana use, all while still asking his permission before we kind of proceed with that.